residents. In the upcoming weeks, we will also be offering webinars on some special topics such as affordable housing and hurricane preparations. Stay tuned for the invitations to these events by following us on social media or signing up for our weekly bulletins by visiting our website. All right, I would be remiss if I don't explain a little bit more broadly about why we're so interested in the nonprofit sector and why we've been offering these webinars. All of this is part of a broader research initiative in which we have defined some specific topical areas or research directions that, as I mentioned, we've been exploring over the last 23 years, and which we think are seeing some accelerated effect as a result of COVID-19. Our center director, Dr. Howard Frank, called it the Great Accelerator. The economic and structural issues, the social challenges that we've been dealing in our community are not new. They've just been exacerbated as a result of this crisis. So with that in mind, we seek to address these existing challenges and any new emerging challenges as a result of the crisis by analytics, of course, which is one of our strengths, but more importantly, by trying to forge short and long-term solutions. And I have to emphasize the long-term solutions a lot, because we're seeing the immediate response, we're seeing the assistance our residents and organizations are getting, whether they're from the business community or the nonprofit community. We'll hear about this in a few minutes. But at the same time, we also have to think strategically about what we can do long-term to create what I said earlier, that equitable, inclusive, and sustainable community and economy. So you'll be hearing more from us on all of these topics and these emerging strategies in the upcoming weeks and months as the situation evolves. With that, let me now introduce our speakers, and we can move to the main portion of our program. First up, we will have Kellen Roldan, who is our research and outreach coordinator at the Metropolitan Center. She has been with us for about 2 years now, and she's become instrumental in many important studies over the last few years within the topics that I mentioned earlier. Some of the recent work that she's been involved with or led includes focus groups in Miami-Dade and Broward counties on U.S. Census participation, a blueprint on the special needs community in Miami Lakes, and more recently, a report on the economic impact of the nonprofit sector in Miami-Dade. This work is what she will talk about in some detail, but more importantly, she'll talk about South Florida's nonprofit sector. Next, we will have Lindsay Linzer with the Miami Foundation and Deshaun Weber, also with the foundation. Lindsay is the Senior Director of Programs and Grants Administration, and in that role, she oversees the foundation's fiscal sponsorship portfolio, manages special initiatives with partner foundations, and directs several grant programs. She joined the foundation in 2017, but prior to that, she worked as the Grants Administration Officer at the Knight Foundation, where she managed the grants processes and systems, as well as some special projects. Lindsay has also served as program manager at the Community Foundation of Broward, overseeing leadership development and capacity building programs. She is originally from South Florida and holds a bachelor's degree in business from Emory University and an MBA with concentration in nonprofit management from Columbia Business School. Deshaun, also with the Miami Foundation, is the Resilience Project Manager. He leads the implementation of the Building Prosperity Initiative, about which he will talk about today, and supports the Miami Foundation's civic leadership agenda. Deshaun was a program associate with advisory services at the Democracy Collaborative, where he facilitated place-based collaborations throughout the country to advance equitable and inclusive economic strategies. Deshawn was also an Emerson National Hunger Fellow at the Congressional Hunger Center, where he worked at the Jersey City Department of Health and Human Services and Prosperity Now to create equitable economic system change responsive to community needs. Next, we have Gretchen Beasing, who is the CEO of Catalyst Miami since 2013. She joined Catalyst in 2007, directing civic leadership and advocacy programs for more than 5 years. She effectively transitioned Catalyst from a financial literacy provider to a financial capability thought leader, as evidenced by the many national partnerships and demonstration projects that the agency has now. Under Gretchen's leadership, Catalyst leads a consortium of partners to design and implement Florida's first universal children's savings program called Future Bound Miami. Future Bound Miami launched in November 2019 with a subset of Miami-Dade County public schools and will expand until every kindergartner entering the district each year has access to a college savings account. Gretchen serves on many community boards in advisory capacity and has been recognized as a community leader both locally and nationally. Leo Perez has been a key leader of the award-winning human rights organization, the Coalition of Immokalee Workers, for over a decade. Today, as part of the Fair Food Program, Leo and his colleagues educate tens of thousands of farm workers on their rights in the field on all farms participating in the program, including the right to work free of slavery, sexual violence, and other health and safety risks. Finally, Uriel Zelaya Perez is the national coordinator for the Alliance for Fair Food, a diverse network of students, people of faith, and broader community members across the country working in partnership with the Coalition of Immokalee Workers toward a food system based on dignity and respect for farm workers. Mr. Zelaya Perez attended the University of Florida in Gainesville, studying philosophy and Latin American history. That's where he learned and became involved with the Coalition of Immokalee Workers and their struggle to eliminate abuse in the field. With that, I will now give the floor to our first speaker, Ms. Roldan, who will give us a brief overview of the nonprofit sector in South Florida. Helen?
Thank you so much, Maria. Good morning, everyone. My name is Helen Roldan, and I'll be briefly covering the nonprofit sector in the Miami Metropolitan Statistical Area. The Miami MSA is the largest in Florida and the 7th largest metropolitan statistical area in the United States. This MSA covers the greater Miami region, including Miami-Dade, Broward, and Palm Beach. Many of you are already in the nonprofit sector joining us today, but for those of you that are not as familiar in the sector, on this next slide, I'll be primarily focusing on 501c3 nonprofits, which I list. 501c3 nonprofits are also known as charitable organizations, which are tax exempt due to their mission. There are other nonprofits, of course, but this is the sector that I'll be focusing on. Nonprofits tend to serve important functions that are not fulfilled by other sectors as they respond to unmet needs in communities, as we all know. Oftentimes, they provide services to marginalized and impoverished communities who already face higher levels of sickness, stress, and a lack of resources. This sector also heavily relies on volunteers. Due to COVID-19, nonprofits have been increasingly responding to the rising needs of the communities in areas like food assistance. One organization I will discuss later on has had to quadruple the number of meals they typically provide to families due to the crisis. The rest of our panel today, of course, will be addressing how they are providing services to the community. The IRS classifies nonprofits into one of these categories listed with more specific subsectors. A few examples of nonprofits in the South Florida community include Farm Share, which provides food for individuals in need throughout Florida and has been of great help to many families during this pandemic. St. La Haitian Neighborhood Center, which has been responding to a demand and help with unemployment applications and tax preparation, and Branches, which has been providing loan application assistance, food assistance, and financial coaching, to name a few organizations. This next slide covers nonprofits in the USA. Nonprofits are the USA's third largest workforce sector after retail and manufacturing. Since 2013, the sector has largely increased in the number of employees and number of establishments. In fact, from 2013 through 2017, there was a 9% increase in the total number of nonprofits in the United States to a total of 300,000 today. In the same period, there was a 7% increase in the total number of employees in the sector to about 12.4 million employees, not including volunteers. As we all know, there are many volunteers in the nonprofit sector. That translates to 10.2% of all employees in the USA who work for 501c3 nonprofits. There are nearly 140,000 employees in the Miami MSA who are in the 501c3 nonprofit sector. This accounts for 6.5% of all the workers in the Miami MSA, which is less than the overall percentage in both Florida and the United States. As I mentioned, 10.2% of employees throughout the US are employed by 501c3 nonprofits. In Florida, that number is 7.3% of all employees. So Miami is just a little bit below Florida. Compared to other benchmark metropolitan statistical areas like Denver, San Diego, and Atlanta, the Miami MSA has a smaller percentage of overall workers and establishments in the nonprofit sector. In the Miami MSA, even though there are only 7% of 501c3 nonprofits that are considered essential workers due to their subsectors classification, of course, due to COVID-19, it's likely that there are a number more in the sector who have had to pivot their typical work responsibilities to address essential needs in the community. There are also plenty of volunteers in the community who are helping nonprofits give out food and unemployment applications, for instance. This chart depicts the top 5 subsectors in South Florida's 501c3 nonprofit sector organized by wages. You'll see that the top sector is hospitals, followed by ambulatory healthcare services, etc. The average overall wage in the Miami MSA for this sector is $49,824. However, this number does include higher education and healthcare. In the upcoming report that Maria briefly mentioned, that we will be releasing in the next few weeks, we go into a little bit more detail on median wages, and we look at overall numbers as well as numbers that exclude higher education and healthcare, as both of these sectors can skew the overall wages a bit. In addition, that report is going to look at trends that occurred during the 2008 and 2009 Great Recession, as we may experience similar trends after COVID-19. So stay tuned for more information coming soon about that report and its launch date. This next slide depicts the top 5 subsectors organized by number of employment. You'll notice that 3 of the top 5 subsectors by employment are healthcare related. And the total number of employees is almost 140,000. The following slide depicts the top 5 subsectors organized by number of establishments. The religious, grant-making, civic, professional, and similar organization sector has 804 establishments. In one of the previous charts, it was the 5th highest when it came to average wages per employee. So, how do nonprofits receive revenue? Nonprofits, as we know, do not generate a profit. They raise their revenues through a myriad of ways, some of which are listed on this slide. This includes fundraising, individual donations, and major gifts, fees for goods and services, and corporate contributions, to name a few. Unfortunately, COVID-19 has presented issues for nonprofits as they seek to continue receiving revenue and maintain their employees, similar to many other sectors. As fundraisers have had to be canceled, as well as services that used to be provided in person, many nonprofits have had issues in maintaining their revenue sources. While some have received support from foundations and donors, that is not necessarily the case for all of them. Shortly, we will hear from the Miami Foundation and how they've been able to assist nonprofits through their relief fund. According to the Florida Nonprofit Alliance, there are several other ways that COVID-19 is impacting nonprofits. At the same time that there has been an increase and sustained staff and volunteer absences, as well as a disruption of services in the community, there's been an increase in demand for services and support from both cities and communities. So nonprofits have had to balance both of those 2 issues. So In the next slide, it shows how are South Florida's nonprofits responding to COVID. Unfortunately, some like Goodwill have had to shut down operations. In fact, Goodwill had to lay off most of its 2,300 workers, many of who live with disabilities or have difficulty finding a job due to other issues. Other nonprofits have had to pivot their typical services offered to the community. Like many other sectors, that means working from home and providing virtual services. For some, like Big Brothers, Big Sisters of Miami, that means in addition to figuring out how to provide mentorship and educational services virtually, they've also had to add services they didn't already used to provide, such as providing food services in bulk, due to the need that their families are facing. Branches is another organization that has had to make significant changes. Branches is a local nonprofit dedicated to providing opportunities to families to break the cycle of poverty. They had to cancel their annual benefit dinner, which is also their largest fundraiser of the year. Instead, they moved the auction portion of their fundraiser online, though they did state that the loss of revenue will be significant. However, they are an example of a nonprofit trying to adapt in the face of adversity. They've secured a matching grant to convert any donations, matched 1-to-1. They've also quadrupled the amount of food that they typically provide their families due to the crisis. They've also been able to offer virtual services such as financial coaching, tutoring, and tax prep assistance. While the impact of COVID-19 will greatly affect them and many others, they are trying to find ways to continue moving forward and provide services that the community needs. As part of our upcoming report on the nonprofit sector, the FIU Jorge M. Perez Metropolitan Center has teamed up with Miami-Dade County to conduct a survey to understand how the local nonprofit sector is managing through the COVID-19 crisis. Some of the questions that we are asking organizations to answer include, what are the ways that COVID-19 has affected operations and services of their organization? What has the change in staff been, if any? What are the anticipated revenues that will be lost due to COVID-19? Whether they've been able to receive assistance due to COVID-19, et cetera. We hope that once we publish this information, it's going to be useful to inform the at-large community as well as the donor community with the necessary information to support the nonprofit sector during this difficult time. We will be sharing the survey link in a follow-up email to all registrants of today's session, as many of you are in the nonprofit sector. We specifically want leaders within the nonprofit organization to respond to the questions, as they may be the ones best suited to address them. Lastly, much of the data I've shared can be found in our latest infographic, which will be released later today. As was mentioned earlier, our center has been releasing infographics on various sectors of South Florida in order to better understand the numbers behind many of the sectors that COVID-19 is directly impacting. So stay tuned for that. Thank you, everyone, so much for your time this morning. I look forward to hearing from our upcoming speakers and address any questions that you may have.
Maria, I think you're on mute.
I'm sorry. I was just saying that, Lindsay, you're next up. We look forward to hearing what you say, what the Miami Foundation is working on.
Perfect. Thank you, both Helen and Maria, for inviting us to be part of the presentation today. My name is Lindsay Linzer. I'm Senior Director of Programs and Grants Administration at the Miami Foundation. For those of you who don't know the Miami Foundation, we are the community foundation for Miami with 50 years of experience partnering with donors in our community to help them champion their causes to improve the local quality of life. We do this by taking a leadership on civic issues, investing in our community, and nurturing philanthropy. So as we heard from Helen about the state of the nonprofit sector right now, we know that our community is hurting. It's the families, it's individuals, it's small businesses, and it's nonprofits. And at the Miami Foundation, as a community foundation, we're in a somewhat unique position. We have the trust of private philanthropists and the donors to our foundation who hold donor-advised funds. We have the partnership of nonprofits. We partner every year with nonprofits, both to award grants and on Give Miami Day, where we have a network of 900 nonprofits that we work with to encourage philanthropy for our community. And we also have the ear of government. So we sit in this unique space where we really, we have a lens into what is happening across the community. And that really, it's important every day, but during a time of community crisis, that unique position within the community is really important, and we're trying to leverage it at this point in time. We know that the needs of our community go well beyond what community foundations and private philanthropy can support. And so as we're thinking about the role that the Miami Foundation can play in helping to support community recovery, we are working with those partners, with businesses, with government, with philanthropists, with nonprofits to both try to just understand the impacts, what is happening on the ground, and then trying to connect the dots. Where can we partner and form collaborations and ensure that the solutions that we're trying to invest in will support both getting through this health crisis as well as helping our community recover. As a start, right after the crisis really took hold, our programs team, 5 of us, have been on the phone with nonprofits daily, trying to understand the impacts. And we've also put out to the community, it's kind of a survey, information form, whatever you want to call it, just to say, tell us the impacts on your organization. So similar to what it sounds like FIU Metropolitan Center is going to be putting out, we needed to know from day one, what are the impacts? Are you laying off staff? What are the financial impacts? Do you have operating reserves? How are you meeting the needs of clients? And the truth is, we have some organizations that have come back to us weekly since this has started to keep us up to date on the impacts that they're feeling as an organization. And it's constantly evolving. And so we are encouraging folks to continue to let us know. We need organizations to tell us what's happening and the impacts you're feeling. We're not on the ground. Organizations like you all, as part of this presentation, you are on the ground. And so we need to hear from you so that we can then bring that information back to government, back to funders, and do the best that we can to both connect philanthropic dollars to the actual needs on the ground. That is the role we can play, and that is the role we're trying to play in terms of using our expertise. But what have we heard? It's similar to what Helen did mention. Organizations in our community, they don't have operating reserves. And so about 50% of the organizations we've talked to don't have operating reserve. And so when they were hit with loss of income, because they can't sell tickets, they can't charge admission because their venues are closed, funders are pulling money, they aren't serving students, so they're not getting income from serving families. They didn't have just a pile of cash there to help them continue to operate. So we are seeing layoffs across the sector, and it's been most pronounced within the arts space, within the arts and cultural space in Miami. The Department of Cultural Affairs did a terrific survey of arts organizations and are looking at it month by month. So just in the month of March alone, the Department of Cultural Affairs was able to tell us that organizations and our arts organizations in our community lost $23 million in funding, and 1,700 jobs were either lost or furloughed. So that's just one sector of the nonprofit space, but every organization is hurting. And so while some had to close their doors and moving operations online, others are still needing to show up and be on the front lines to distribute food and basic supplies to communities that don't have access, and trying to do it in a safe way when it's really hard to get the protective gear that they need to do it safely, deliver food to homebound seniors and people who otherwise would not be able to get to a food distribution site. Organizations like Miami Diaper Bank, thinking about not only are they distributing diapers to the various healthcare providers and families across our community and working with all of the early childhood, organizations to get diapers in the hands of those families that can't just go on Amazon and order it, one, because of shortages, and one, because these families don't have money to order it. The need has, I think it's 8 times over the need that they've seen compared to kind of standard times. And they're also serving a food need. They're also trying to get formula in the hands of families that can't afford that. Organizations like Catalyst Miami, I know you're going to hear from Gretchen later, helping organizations connect to financial resources in partnership with the United Way Pandemic Response Fund and helping them navigate benefits. We've all heard in the news how poor our unemployment systems are and how tricky it can be for individuals in our community to actually get the financial resources they need and apply so that they can access those dollars. So organizations like Catalyst and branches have been critical in helping individuals in our community really step up. And these groups are doing it from home, trying to get laptops in the hands of their team members and get them the equipment that they need so that they can do this work from home. And so while we've been saddened, it's hard. We're hearing about, the negative things happening in our community and the hardships being felt by individuals, I must say, I've seen a shift in the past few weeks, and I'm seeing more optimism, which has been really exciting. Nonprofits have kind of adjusted, and they are the ones coming up with really creative solutions on how to meet the community where it is and get them their needs. And so we've been really excited by some of the exciting developments that are coming and really being started up by the nonprofit community in partnership with business and in partnership with government. So, for example, Access South Florida. I don't know if any of you have heard of it, but it's a collaboration between Citi and Microsoft and frontline nonprofits that are serving those financial needs for individuals and small businesses, helping them navigate and understand where they need to go. Okay, you're an individual who lost their job. Here, take this path, apply here, do this. Oh, and you need to call somebody for help getting a loan. Here's a number. You're a nonprofit that needs assistance with your small business loan. Here, follow this path, call this number, this 24/7 hotline. So this idea of actually using these connections, bringing everyone together, we're seeing solutions pop up, and that's what the Miami Foundation is excited about. And that's what, when we think about our future investments in the community, those are the types of things we're going to be looking to invest in, figuring out where with our limited dollars we can have an outsized impact, because we know that we're not going to be able to raise enough to make a grant to every organization in this community who needs it, because we know the financial hit. Every organization, they don't have operating reserves, they all need grants. We don't have the money to grant to everyone. So what we can do is both connect the dots in bringing business, philanthropists, nonprofits, and individuals together to create solutions, and then make financial investments with the limited dollars that we have to help lift up what we see as the best solutions in our community that will help the most people as well as the most nonprofits. So we're trying to use our influence and leverage to both make wise investments in some of these creative solutions. But what we're also doing is, in the short term, as we're working to raise money to make those types of investments, we're connecting our donors, our donor advised funds, as well as some other national funders who have come to us to say, where are the immediate needs? And so we're using the information we've gathered from surveys, as well as the conversations we've had with nonprofits to help connect those donors and our donor advised funds who have major money to move to the issues on the front line. So the information you've been sharing with us is not in vain. That is being used as we talk to donors day in and day out. We're telling donors, here, this organization needs this. Oh, I know you're interested in healthcare. Here are the organizations on the front lines that need funds for XYZ. So we're really trying to do this matchmaking in the meantime while we raise funds so that we can start beginning to do that investment in longer term solutions as our community looks to come out of this health crisis and deal with this economic crisis where we know we're going to need to support figuring out what our new economy looks like and where job training needs to be and where the jobs are. And I know that's a lot of what Deshaun is going to cover in just a minute. But I hope you guys will look to the Miami Foundation as a partner in this work. We want to be a resource to everyone here. Please tell us the needs that you're having. Tell us the creative solutions, the ideas you have, even if they feel crazy. Tell us them. We will help connect you with a business, with a funder. We're going to try to connect the dots with you. We want to be your partner. We can't always be your partner in terms of giving you a grant, but we can be your thought partner, and we need you to be. We can't do this alone, so we thank you for your partnership and hope we can be a resource to you. Thank you.
Thank you very much, Lindsay. Deshaun, you're up next.
Awesome. Can you all hear me? Am I good?
Yes.
Okay. Awesome. Thank you so much, FIU Metro Center, for inviting the Miami Foundation to take part in this webinar today. Again, I really hope everyone is healthy and well and taking care during this time. Like Helen said at the top, Helen and Maria said at the top, I'm Deshaun Weber, the Resilience Project Manager at the Miami Foundation. In my role, I lead the implementation of the Building Prosperity Initiative, which I'll briefly share more about today with you all. Almost a year ago to the day, JP Morgan Chase provided a 3-year, $3 million grant to the Miami Foundation to convene the partners to build pathways out of poverty and into living wage occupations. Our partners during this initiative are the City of Miami, the Health Foundation of South Florida, Catalyst Miami, who you'll hear from more today, and FIU Metropolitan Center. Our collective task for this initiative is to build prosperity through workforce development and small business expansion strategies. This strategy that we are implementing is really a systems level approach and is focused, as Maria said up top, at long-term solutions. Each team is responsible for leading a specific body of work that will increase living wage jobs. For our purposes, living wage jobs have been defined as $15.30 an hour. Catalyst Miami is one of our lead partners, and they are leading a workforce development cohort in which they provide professional development and connect attendees to employment agencies. The City of Miami's Opportunity Center is identifying job openings, building relationships with small businesses, and referring job seekers to positions at those same businesses. Health Foundation of South Florida is convening the South Florida Anchor Alliance and is providing a space for their network of hospitals, governments, and local nonprofits to best coordinate their activities to address the economic and social conditions that are most pressing for our community. The Miami Foundation, in addition to coordinating and convening our partners, is convening a group of small business providers to identify opportunities and gaps to support our small business community. Now, before we started this approach, we wanted to better understand the current circumstances of Miami. And so we commissioned a workforce asset map. Ultimately, the goal of this report was to identify where the living wage jobs are now and where will they be in the future, as well as where are the workforce development opportunities that align with these living wage jobs and where there might be opportunities to build. So we began by taking a deep look at the data, the labor market data, to better understand what the quantitative data was telling us. We complemented this understanding with perspectives from community leaders, employers, nonprofit leaders, economic developers that we brought into focus groups to better understand how their unique perspectives could inform the overall strategy and approach. So after numerous workforce convenings and after months of looking into the data, we identified 9 growing occupations and 6 systemic barriers to workforce development. Again, these growing occupations that we identified are at $15.30 an hour. They are not at risk of automation, and perhaps most importantly, offer opportunities for career growth and have low barriers to entry. So a high school degree could apply. To allow for time for Q&A, I'm going to just be brief with the occupations and the systemic barriers. And I just sent in the chat box a link to the report, so you all can dig into that. So just a few of the top jobs that we identified are electricians, medical secretaries, and customer service reps, among others. And then when we're thinking about these systemic barriers to deepening the impact of workforce development in our region, we identified barriers to workforce participation, like transportation and childcare for folks. There is some confusion around career awareness initiatives. So folks that don't understand perhaps where some of these career trajectories line up. And then a lack of talent retention and attraction strategies. Again, please check out the chat box for more information regarding this. I'll connect with Helen to share this, our report with you all after this meeting as well. So, with this understanding, with this research that we have, the team now has a more comprehensive analysis of where the opportunities and gaps are to begin deepening this systems level approach. First off, the research will direct the Miami Foundation's investment in 2 interventions that overcome the systemic barriers that I mentioned, as well as support some of the occupations that I mentioned. Of course, as was said at the top, COVID-19 has only increased the need for community and worker-centered approaches to prosperity, and we have pivoted our approach accordingly. The City of Miami's Opportunity Center has become a resource for both workers and employers locally. Not only are they connecting with recently furloughed staff to new opportunities, they're also encouraging employers to post jobs with competitive wages. Catalyst Miami, as you'll hear more from today, they've transitioned their group to think about technology literacy and have supported their workforce cohort to navigating financial security at this time, leveraging all of the great resources that they provide. The Health Foundation of South Florida is convening the South Florida Anchor Alliance, utilizing the urgency of this moment to coordinate activities of the network. We have reached a critical moment for this work, and we have a better sense of where the challenges that face our community, and we are prepared to shift the conditions that hold poverty in place. Again, I just want to stress that COVID-19 has really only exacerbated the systemic issues and inequities that were prevalent to this pandemic. Now, possibly more than ever, we, the Miami Foundation, are committed to joining forces with the broader Miami community to ensure that Miami and those who call it home can bounce back more resilient and prosperous than ever. Thank you again for everyone for participating in this webinar. I hope you all are healthy and well, and please feel free to ask any questions, and I'll be checking out the chat box to see if I can jump in there as well. Thank you all.
Thank you, Deshaun. Gretchen is the CEO of Catalyst Miami, and we'll talk a little bit about their work. You already heard about the many things that they do and partnerships that they are part of. Gretchen?
Hi, good morning, everyone. I'm Gretchen Biesing. I'm the CEO of Catalyst Miami. We're a nonprofit serving Miami-Dade County. We were founded in 1996, and I would be remiss if I did not note that our founder, Daniela Levine-Cava, is actually attending this webinar today. Hi, Daniela. Okay, so Catalyst, our mission is to identify and collectively solve issues that adversely affect low wealth communities throughout Miami-Dade County. People will say, well, what exactly does that mean? I mean, it can mean a lot of things. I like to think that it speaks more to our role in the local ecosystem than it necessarily does to discrete bodies of work. We have been working on the ground in low wealth communities for more than 20 years. And as a result of that work, we have a pretty good idea about what's happening in those communities. We get a lot of feedback from people that participate in our programs and that use our financial services. So we play a canary in the coal mine role, so to speak. And we're very much focused on equitable economic development, doing this both through the services, but also through our public policy agenda and the organizing and grassroots leadership development that we do in the communities that we serve. So that's a little bit about what we do from a high level. I want to underscore some of the things that Deshaun just closed with, which is that COVID-19 is having and will continue to have a disproportionate impact on the communities that Catalyst Miami and many of you care about. Before COVID-19, we had a lot of data sets that were telling us a story about economic inequality in our community, pervasive financial insecurity, limited liquid assets among most families in Miami-Dade County. You know, these data sets include the ALICE work that the United Way does, ALICE standing for Asset Limited, Income Constrained Employed Folks. Prosperity Now, which is a national organization, has also done a deep dive into the city of Miami. About a year and a half ago, a consortium of universities from around the country, including the Kirwan Institute at Ohio State, released the Color of Wealth study, and that was looking at racial disparities in wealth throughout the Miami MSA, so also including Broward and Palm Beach counties. And then I want to also note that very recently, well, for several years, but most recently, some great reports have come out from the JP Morgan Chase Institute, including one yesterday that talked about how there are definitely racial gaps in the financial incomes that are only going to continue to grow as this pandemic goes on. And this is because people of color are more likely to be in low wage, hourly positions. They're more vulnerable to layoffs and furloughs, and they're less likely to have really important benefits like paid sick leave. So there's a lot of work to be done. For our part, we have pivoted a number of our services, and we have been really leaning into some key partnerships with other organizations in Miami-Dade County. We, for years, have had a tax hotline. Free tax preparation is one of the services that we have provided for over 15 years. We now are using that hotline number to answer any question, provide referrals, provide services to anybody as a result of COVID-19. So not just for taxes, but really for any of our services, and also for referrals for services that we're not able to provide. I can tell you that, let me tell you a little bit about some of the calls that we're receiving. So for sure, there is way more demand than supply. The number one request that we get from people that call us is help getting food, either money to buy food or information on where they can go and get food. We get a lot of questions about utilities, whether there's a moratorium, our moratorium is going to be extended, and if they're not extended, or when that extension ends up, how am I going to pay that bill then if I don't have any income and I don't know when I will have income? Past due bills, that could be a phone bill, car insurance, and medical debt is coming up quite a lot. We get a lot of questions about rent, how to pay rent. And we are seeing increased demand for help with tax preparation. As many of you probably know, the Earned Income Tax Credit is a great way for low-income families to get some liquidity during this time. Most low-income families get their taxes done in the early end of tax season, but for those that had not yet had an opportunity, now is a great time for them to get that extra cash. We're also getting a lot of calls about help navigating the state of Florida's reemployment system. People are trying to apply, they're not able to, they have applied, they're not getting any money. And the final area where we get a lot of calls is around small business concerns. So we serve a lot of micro businesses, and many of those that have some sort of storefront or retail operation are calling because they need legal assistance renegotiating leases, commercial leases. So those are some of the top concerns that are coming into our hotline. And now I'll tell you a little bit about how we've pivoted our services. So our flagship program is called the Prosperity Campaign, and under that umbrella, we provide a number of different services, all of which we are now able to provide virtually. It took us a few weeks to make that pivot. We continued to serve current clients by phone the first few weeks after we closed our offices to in-person appointments. We are now able to provide everything virtually and see new clients. The reason why it took us a while to begin seeing new clients is because many of the services we offer require some sort of identity verification, which is impossible to do just over the phone. So now we're able to see new clients, which is very fortunate. I would say that the limitation on that is that there are many people that need services that do not have the internet access or the literacy to engage with us on the other end virtually. So that's still a community need, and we have not yet figured out how to navigate that, but we are thinking through some ideas. So our list of services, as I mentioned, we're continuing with tax preparation, and we have been working with a number of partners, branches included, the United Way, City Community Development, Microsoft, to launch a virtual VITA platform. VITA is the Volunteer Income Tax Assistance Program, and there's now a virtual version, which is really helpful. We've also been partnering with many of those same organizations and organizations in Broward County. Also, again, City Community Development, Microsoft, on the Access Helps network, and accesshelps.org helps people navigate services that are available. Lindsay mentioned that earlier in her presentation. We are providing technical assistance and loan product navigation for small businesses. We are helping people apply for reemployment. And we are also helping folks access the Miami Pandemic Assistance Program funds. That's a fund that's being powered by the United Way and is offering help with food, utilities, and rent. There are a handful of other funds that are being run by national partners that we are able to access. And by the end of the month, we're hoping to launch our own fund with some of our reserve dollars so that we can provide cash grants to families that we're working with. That fund is not live yet. We're still putting it together, but we hope to launch it by the end of the month. And I'll say finally, you know, Catalyst provides a lot beyond just the prosperity campaign services. We do various leadership development programs, a lot of policy advocacy, and much of that work has been pivoted to really address policies that can help the families we serve right now. So we've been very active with educating people about moratoriums, requesting to groups like Florida Power and Light to extend moratoriums on shutting off power, asking for a stay on all evictions, a moratorium on evictions, you know, talking with our state legislature about the importance of expanding access to health insurance at a time like now, thinking through things at the local level like paid sick leave. That's coming up at the county commission, I believe, on Friday. So these are some of the policies that we're really getting behind and pushing. And I will pause there and happy to answer any questions.
Thank you very much, Gretchen. Next, we have our two speakers from the Coalition of Immokalee Workers. I'm not sure which one of you wants to speak first, but thank you for joining us.
Thank you so much. Hello, everyone. My name is Uriel. And I work with the Alliance for Fair Food, and I'm going to be co-presenting and interpreting with Leo from the coalition. I'll let him introduce himself.
Hola a todos y todas. Buenos días, yo me llamo Leo y parte de la Organización de Trabajadores del Campo.
And so, hello everyone, my name is Leonel, and I'm part of the organization, the Coalition of Immokalee Workers, which is made up mostly of farm workers.
Y estamos en la comunidad de Immokalee, en condado de Collier, donde nuestra comunidad, la mayoría son trabajadores del campo.
Yeah, and we're based in Immokalee, which is in Collier County, of which, for the most part, the people that make up this community here in Immokalee work in the agriculture industry as farm workers.
Nuestra organización empieza del 93, donde enfocado de eliminar lo que es la explotación y lo que es la esclavitud moderna dentro de la industria agrícola aquí en Florida.
Yeah, our organization, for some context, was started in 1993. As a direct response to seeing how we can eliminate exploitation that farm workers were facing at that time, specifically rampant modern-day slavery that was happening in the industry.
Y en los últimos 20 años hemos visto 9 casos de esclavitud moderna que fueron procesados también en la corte y castigados lo que hicieron.
Yeah, and in those, since the inception, for those 20 years, we've helped prosecute 9 cases of modern-day slavery, freeing thousands of workers and prosecuting those culprits.
En el 2000 cambia la estrategia de nuestra campaña porque al principio pensábamos que era la industria agrícola tenía el poder de hacer estos cambios.
Yeah, in 2000, our strategy shifted because at first it was really focused on growers, the people who owned the farms, and thinking that they were capable of creating change.
Pero vimos que grandes corporaciones como Walmart, McDonald's, Burger King, Taco Bell tenían un poder muy grande sobre la industria agrícola donde compraban sus vegetales baratos y eso llevaba a los trabajadores de un salario muy, muy limitado.
But what we started seeing was that big-time corporations like Walmart, McDonald's, Whole Foods, and other fast food corporations had significant power in the agricultural industry, and that with that market power that they had, they suppressed a lot of the wages and created a lot of the conditions that were happening in the supply chain.
Por ejemplo, esto es, no sé si pueden ver, es una cubeta de 32 libras de tomate y cuando nace la campaña pagaban de 35 a 40 centavos por una cubeta de 32 libras.
Yeah, and so for those who are joining us via video, if you can see this here, this bucket holds about 32 pounds of tomatoes. And when we first started our campaign, the average wage that workers were getting paid was about 35 to 40 cents for filling up one of those buckets.
Y hoy en día el promedio es de 50 centavos por una cubeta.
Yeah, today the average is about 50 cents.
No importa cuántas horas trabajas, sino que por la cantidad de cubetas que haces. Y por eso nace nuestra campaña de pedir a las corporaciones que paguen mejor por los tomates para aumentar el salario de los trabajadores.
Yeah, and it's never mattered in terms of how many hours you're actually out in the field. It's always been production based by the amount of buckets that you picked. And for that reason, we started a campaign with corporations demanding that they help change the conditions that farm workers were facing in their supply chain.
Y no y que se comprometan de no comprar en las compañías donde sigue la explotación.
And part of the demands was asking that they not purchase from farms where there was rampant exploitation happening.
En el 2010, el 90% de la industria agrícola de tomate especialmente vienen con la coalición de cómo trabajar juntos, eliminar esos tipos de abusos.
Yeah, in 2010, about 90% of Florida's tomato industry, an industry that I would add was a $600 million industry with tens of thousands of workers here in the state of Florida, decided to join and work with the coalition to protect these farm workers in their farms.
Entonces, ahorita miles de trabajadores están beneficiando estos derechos que existen en la industria agrícola, pero nuestra comunidad sigue muy vulnerable en otras situaciones.
Yeah, and so today, thousands of workers are receiving protections, unlike previous workers had in this industry. However, although we've been able to do all of this work, there's many other sections and many other ways in which this Immokalee community continues to be vulnerable.
Y antes que iba a mencionar eso, son 14 corporaciones pagando, vigilando los derechos, pero nuestra campaña enfocada hoy en día es contra Wendy's, tenemos un boycott y también con Publix.
Yeah, and just before we move on to the COVID element, though, today we're working with 14 corporations, and we currently have campaigns with Wendy's and Publix that they join and protect workers in their supply chains.
Y viene este virus básicamente en nuestra comunidad, cambia nuestra campaña de enfocar cómo proteger nuestra comunidad.
Yeah, and so when COVID came got here, it completely shifted the work of our organization towards seeing how can we best support this vulnerable farm worker community.
Donde en nuestra comunidad, por ejemplo, viven de 5 a 8 trabajadores en una sola trailer, una sola casa, 3 por cuarto o 2 por cuarto.
Yeah, and so the reason why we started thinking is because in our community, it is not rare for farm workers to be huddled up in 5, 8, sometimes 10. I would add even up to 15 workers in one of the trailer homes, 2 or 3 of them in each room.
Cuando van al trabajo, van en transporte de un autobús como de la escuela, donde van de 20 a 40 trabajadores en un autobús.
Yeah, when you're going to work every day, you get into a school bus. I'm sure you all have seen those school buses used for farm work, and they fill up these buses, 20, 30, 40 workers in one of those buses to go out to the fields.
Y son trabajadores esenciales, básicamente, para considerar como trabajar diario.
And at this moment, they've been deemed as essential workers. They're still going to work day in and day out.
Y lo que nosotros estamos haciendo, básicamente, cómo proteger esta comunidad, porque básicamente el condado o el estado no tomó una responsabilidad cómo proteger a los trabajadores.
And so what we've had to do as an organization is step in to see how can we work to protect this community, given that our county and our state often doesn't prioritize rural agricultural towns when responding to COVID.
Entonces, muchos de los trabajadores pidieron el trabajo, otros tienen que ir a trabajar, no les queda otra manera de quedarse en casa, no se puede hacer distancia social, por ejemplo.
And so we've seen a lot of workers lose their jobs as institutions. I would add, as FIU closes down, those food orders aren't being made. And so workers are losing their jobs. And there's no opportunity, again, to implement CDC guidelines, right, such as socially distancing yourselves when you are sick.
Y, por ejemplo, en nuestro caso, vivimos juntos en la casa, entonces es difícil.
And in our case, just to answer the question quickly, we actually are roommates, so that's why we're not socially distancing.
Entonces, cambiamos una campaña que fue directamente para el gobernador de la Florida, de cómo ellos pueden apoyar nuestra campaña o nuestro pedido para que los trabajadores sean protegidos, porque la mayor parte de nuestra comunidad no van a buscar un hospital, porque aquí en Immokalee no hay hospitales. Tiene que ir uno como en una hora de aquí.
Yeah, and so what we started doing was launching a campaign petitioning Governor DeSantis. I just sent a link I would add through the chat box. And the main ask was for there to be resources, medical resources here in the community. In Immokalee, there is typically a clinic, but a lot of these resources aren't readily available for the farm worker community. And when we were going into COVID, for us to go to the nearest hospital is about 45 minutes away, to go and get that sort of medical attention.
Y entonces muchos de nuestra comunidad que perdieron el trabajo van a buscar otro trabajo en los campos de golf, en la yarda, en la construcción. Y entonces no podíamos decir a nuestra comunidad que no pueden ir a trabajar porque son trabajadores que están aquí por 6 meses, se mudan y vuelven otra vez.
Yeah, and so those workers, in the agriculture industry that managed to lose their jobs, they've been shifting to other industries, be it landscaping, be it other industries, and there's really not much that we can do in terms of telling them, hey, stay home, protect yourself, because they're living paycheck to paycheck, and they have to have work.
Entonces hicimos mucho ese trabajo de cómo proteger la comunidad. Nuestro pedido al gobernador que haya un hospital en Immokalee como temporal y también que hayan pruebas gratis para los trabajadores.
Yeah, and so we've been shifting to do that work and petitioning, like we mentioned, Governor DeSantis. We've been asking for a field hospital specifically to be open in Immokalee and for there to be COVID testing available to the farm workers.
Y el condado no estaba como apoyando nuestra campaña y creo que el hospital no lo hemos logrado todavía, pero otra de las demandas es los gratis que pueden venir a tomar el test y eso logramos. Ayer fue el último día en Immokalee donde tuvimos 2,000 test parte del gobierno para la comunidad de Immokalee.
Yeah, and so although with our campaign we didn't manage to get the field hospital, actually yesterday was the final day of free, open, and accessible testing to the farm worker community here in Immokalee. Over 2,000 tests were distributed, regardless of any sort of documentation status and such, I would add. And if I can talk a little bit about something else, I know I'm close to my time here, I actually might have passed it, but just want to share these resources. So part of the work that CIW is doing is passing around resources that are in all of the languages here. Immokalee is Spanish speaking, indigenous languages, and Haitian Creole. So we're passing around little packets like this with information. We have a community radio station giving information as well. We have done art pieces, not just, the CDC stuff, but art pieces that speak to the community in the language that is accessible to them. And as we mentioned, we had the testing a couple of days, and so we're passing out these flyers all around here in the Immokalee community and surrounding rural communities as well, letting them know about the testing that is being done. And also some of the work that we've been doing, as Leo just highlighted, is passing out face masks. We've passed over 10,000 face masks here to Immokalee farm workers and distributing them all around town. So that's been the way that our work as an organization that typically focuses on farm worker rights has shifted in the era of COVID. And if anything, just echoing what everyone says, tightening of resources, more demands, a lot of people have more needs. We're seeing that happen in our community.
La mitad de la máscara hecha por las mujeres de la comunidad y otras mitad que fueron donadas de diferentes organizaciones o grupos afuera.
Yeah, and part of the work is when you don't have support from the outside, half of the masks that were distributed were actually done by the Farm Worker Women's Group here with the Coalition of Immokalee Workers. The other half was masks that were donated by other groups and such. And so that's part of the work that we've been doing. But I know we've been past our time, so we'll cut it there.
Well, that was truly humbling to hear, and thank you for all your work. We understand it is important to protect our food supply, but more importantly, it's important to protect human lives. So thank you for the work you do in that regard. And I also want to thank Deshawn, Lindsay, and Gretchen for their participation and for informing us about the important work they do, whether themselves as an organization or in partnership with others. It's great that we have such a support system for our community in the face of all of you. With that, I'll open the question and answer session, which Helen will lead, and she will direct questions appropriately. Helen?
Yes, so thank you everyone for sending in some of the questions today. And again, thank you for my fellow panelists this morning. So a few people asked if the slides will be available after the webinar, and they will be. We're going to be sharing the slides that I shared, as well as a link to the survey that we talked about earlier today. Someone asked, this question is for Deshawn. Have you seen any innovative ideas for addressing childcare issues? And I think maybe you can also talk about the soft skills training that the Miami Foundation is adding to the Building Prosperity Initiative, or from Catalyst, I believe.
Yeah, so the innovative childcare solutions, to be frank, I'm not sure. I haven't necessarily seen anything that's risen to the top. I think folks, Catalyst might have some sort of sense of any solutions that they've seen. Okay, I'm seeing a head nod from Gretchen, no. I don't have the answer to that. I can definitely dig into that and then get back accordingly, see if anything has risen to the top across, oh, Lindsay?
I can just jump in to say that's on our radar when we think about the 4 areas where we think potential investment could make sense. That is one of the biggest issues that we see, because in all of the conversations about reopening our economy, childcare has unfortunately not been as front and center to the conversation as it needs to be. So it's on our radar. We are having conversations with the Children's Trust and other organizations across the community to think through what innovative strategies could look like. So I wish I could say we had the idea now, but if you have ideas, please do share them, because that's the type of thing we know needs investment, because we can't go back to work until we have camp and childcare for our kids. So, and national studies are showing that unfortunately, if childcare is not reopened, potentially up to 20% of women who are in the workforce will have to drop out just to make sure that their children are taken care of. So that's not something that's good for any economy trying to restart. So please share your ideas with us if you have any.
And that's a good point. In our email to registrants, I'll share the contact information for panelists in case anyone wants to send anything over your way. So this one is for Lindsay. How has the Miami Foundation stewarding wish list with NPOs to ask Congress for an appropriation in CARES Act 4? Federal government has more money available than reaching out to donors right now.
Yep. So when we think about our public affairs work and our civic leadership agenda, that is where we think, in addition to using the limited dollars we have, is where we can have power. So we are having behind the scenes calls and emails with elected officials trying to use our influence to make sure that nonprofits are not forgotten in terms of funding flowing in from the government, because that is the funding we're going to need to survive. It's not going to come from philanthropy. So we are using our voice behind the scenes to do that, and happy to partner with anyone who wants to send us in a direction that they think is important on that issue. But I can assure you, Lauren Para from our team, who's our Director of Public Affairs, is leading that work along with Deshawn to make sure that the nonprofit voice is heard.
Thank you. So somebody asked, do we have any idea of how many nonprofit employees will be unemployed because of the pandemic? So I know that we are asking that question in our survey that we will be sharing to nonprofit organizations today, starting today. But I don't know if any of you also want to jump in, if there's any rough estimates, maybe how it's impacted your own organization. I'll start with Uriel and Leo. Has it impacted? Do you guys have a rough estimate of numbers?
No, there really hasn't been. It's been very difficult to set a number. We know that there has been farms that have been cutting hours to workers, as I mentioned, right? As universities, as hotels have been cutting their orders of food. And unfortunately, there's some farms that are even allowing this food to rot, although there's big hunger needs, but that's a webinar for another time. But there's farm workers are definitely losing their jobs, but it's very difficult to track that, given that there's always really sketchy information about the population of farm workers for the most part anyway. What we know though is that at least in the Immokalee community, there's about 25,000 farm workers that are here. Some for the most part, are based here, but a big majority of them are here temporarily, and they go up north to other states, usually around this time. And what we're seeing is that COVID is affecting that because growers and farms up north aren't accepting workers. They're saying, there might be sickness. They don't want to take any responsibility. So that's something that we've been seeing. I know that doesn't address the question directly, though.
Thank you. That was informative. Gretchen?
So we're very fortunate at Catalyst that we have not laid anybody off. I can't speak to any numbers sector wide. What I can share is that at least from my perspective, it's not yet clear, for those of us that are dependent on government contracts and both local and national philanthropy, what the full impact will be. The first 3 to 4, the first 3 quarters of this year, we were already funded. We already had the money in the bank for the most part. I think that the 4th quarter of this year and then going into 2021 is when we'll really see what our funding looks like and make decisions about staffing. For those of us that get funded by the county, we know that that tax base has dropped. We'll see what comes out in the mayor's budget in July. Same for other local government resources. For those of us that get funding from corporate entities, including financial institutions, it's not yet clear how that's going to impact their philanthropic giving. Sometimes, money is dedicated the fiscal year before for the following year, so there's a delayed impact in philanthropy.
Thanks. And Miami Foundation, either Deshawn or Lindsay.
So the Miami Foundation has been fortunate. We are not planning any layoffs internally. In fact, for positions that were open, we are planning to continue to plan to hire for those positions. The way we work as a foundation, our fees are assessed on kind of 12-quarter rolling averages, and so that gives us some runway to kind of get through the bumps in the economy as the value of our funds go up and down. So that has been incredibly helpful. We also have not had any grants pulled. And we're planning to continue grant making at the same levels that we have in previous years, because our grant making is also done on kind of the 12-quarter rolling average balance, some percent of that. And so we plan to continue to make investments in the community separate from the community recovery fund investments we plan to make. We will continue our normal round of community grants with actually added flexibility. Some of those grants will be awarded as project grants because that's what organizations have asked for, while others will be awarded as general operating support, which is something we have not done in the past. So we're trying to be flexible, but financially as a foundation, we're good, and trying to just keep our pulse on what is happening with the nonprofit community so that we can share that information with the donors about job losses.
Thank you. We have time for just a few more questions. This next one is for CIW folks. Are farm workers required to live on or near farms, and are they charged for bed and food, which must be paid out of their earnings?
Sí, hay una compañía, creo que tiene como 4 o 5 lugares donde viven los trabajadores en los campos, pero la mayoría viven en la comunidad de Immokalee.
Yeah, so there is, from our knowledge, at least only one company that has housing, about 4 or 5, what we call them fields, around here in Immokalee, where workers are based out and live out of. But for the most part, most farm workers are living in the Immokalee community, not close to any of the farms.
En Immokalee la renta se paga semanal, pueden cobrar de $75 por cada semana por una cama, no por cuarto, es por una cama por semana.
And for the most part, just to give you some context, in Immokalee, most people that live in trailer homes, they pay a weekly rent, and that could be anywhere up to $75 a week. But but when you're paying, you're not paying for an entire trailer. You're paying for a bed in this trailer, right? Not even a room. So you're just buying a spot.
Entonces pueden vivir de 5 a 8 trabajadores, depende de la traila, y uno puede pagar hasta 500, 600 por semana por una traila entre todos.
And so you sometimes have 5 to 8 workers in some of these trailers, and you can be paying close to $750 for a trailer home that isn't in the best of conditions.
Y los que viven en la propiedad de la compañía, ellos sí viven gratis porque ellos trabajan todo el tiempo con la misma compañía. Todo.
Yeah, and as for those that actually do work on the farms or on the, they do get free housing. That's sort of part of the deal, and also they consistently work for that farm. And so what we mean by that is that they move with that specific farm. They might have farms in Georgia, South Carolina, North Carolina. So that worker travels with that one employer. Yeah, and they're only temporarily here. So that's why the housing is offered.
Thank you. This next question is for Gretchen. What is the difference between low-income communities and low-wealth communities?
Okay, that's a good question, and I saw that that Jim Caras also put a good answer in the chat. But you know, low-income community, it really that measure depends on the income, like the money that's earned through a job for the family, whereas low wealth or taking into consideration wealth is about all of a family's assets. You know, cash in the bank, investments, business ownership, home ownership, etc., minus their liabilities or their debts. So, you know, a crisis like this is actually a good way to understand like the importance of looking at wealth rather than just income. You know, income is one driver of wealth, of course, but it's not the only driver, and probably not even the most important driver, because families that are losing income may still be okay if they can fall back on wealth that has been accumulated over time. You know, whether it's you know, the rainy day savings account or an inheritance that they received, something like that. So hopefully that gives you a little bit more. And Jim's answer in the chat was also very good.
Thank you. We have time for I think 2 more questions. So this next one is for both Lindsay and Gretchen. Have nonprofits felt pressure from funders to provide COVID assistance services in order to receive funds and donations? Is that something that either of you have witnessed?
So I haven't heard about funders requiring anyone to provide assistance. We've really waited for organizations to step up and say they have the tools and staff to provide assistance. What I have heard that we're trying as a funder community to kind of get ahead of is many of the organizations that are helping with financial assistance and ensuring individuals can get access to funds, that those organizations may not have existing capacity to manage that process. And so we're trying to work with the organizations that we know that are processing those applications to ensure they have funding to provide, you know, to hire on additional staff that's needed to go through the applications and do the due diligence. But I haven't heard of funders pressuring organizations to provide services. I hope that's not happening.
Gretchen, on your end?
I have not felt pressure to provide those services, but Catalyst is in a position where we would have made this pivot regardless, because it's part of the role we play in the local nonprofit ecosystem. I haven't heard of funders applying pressure to specific nonprofits. However, I am guessing that some pressure might be felt, because I have heard of foundations that have kind of reallocated or realigned their funding priorities so that they're now only giving funding to organizations that are engaged in pandemic response, which might leave some other nonprofits in a position where they're not getting revenue that they had anticipated.
Thank you. And this last question is going to be for Uriel and Leonel. Do you feel that the struggles of farm workers in Immokalee, and I'm going to add this, and also the farm workers across Florida, because we do have many in Homestead, for instance, during the pandemic run parallel to those faced by workers in the meatpacking industry?
Yeah.
Sí, creo que eso fue nuestra visión al principal, que si un trabajador se contagia con otro, llevaría a un grupo de trabajadores. Y eso, por eso nosotros lanzamos esa campaña de proteger a los trabajadores.
Yeah. So when we first started our campaign, we saw that very element, which is that if one farm worker gets sick, it's very likely that the rest of the workers in that cohort are going to get sick.
Y las pruebas que se hicieron, básicamente ahorita vemos quiénes son los trabajadores para aislarlos inmediatamente, o esperamos que no va a ser tanto lo que va a ser positivo a nuestra comunidad.
Yeah, and so for that reason, when implementing these protocols after testing, we're finding ways that workers can actually isolate themselves and protect themselves.
Nosotros pedimos al condado de básicamente una cuarentena obligatoria, pero muchos de los que viven en Naples no quisieron tener eso. Entonces, algunos de los ranchos, ellos quisieron seguir trabajando sin proteger a los trabajadores.
Yeah, during the early stages of our campaign in mid-March, we asked for there to be a curfew implemented and that there would be more guidelines in the community, but people in power, specifically in our neighboring Naples community, weren't so fond of that. There was actually a grower, I would add, Oaks Farms, Seed to Table, that mentioned that this whole COVID thing was a liberal conspiracy. And he even went on record, USA Today article that came out about it. And so for that reason, those sort of guidelines and protections weren't being implemented for workers.
Entonces, y eso no esperamos que pasa como lo que pasó en diferentes industrias de carne, porque sí, eso sí, nuestra comunidad es muy vulnerable para eso.
Yeah, and so we were worried as seeing what was happening, as the question mentioned, right, in the meatpacking industry in the Dakotas, right, where workers were still working, there was no implementation, and they got sick, and we knew that our community was very vulnerable. And so to answer the question then, yeah, absolutely. The same conditions and struggles that workers are facing, farm workers are facing here in Florida, are being faced by fast food workers here as well, and by other workers in other industries all across the state. And unfortunately, if they don't have organizations like CIW or unions or any sort of other nonprofit organizations that are going to bat for them, God knows, that other instances like what Dakota, what those meatpacking workers in the Dakotas face could likely be something that they face.
Thank you. And with that, thank you again, everyone, for joining us this morning and the other panelists. This concludes today's discussion. As I mentioned earlier, we will be sending links to today's recording, the slides, and any of the resources that we discussed. So thank you once more, and we look forward to having more conversations in the future. We will be having, as I mentioned earlier, an upcoming session related to our upcoming report on the nonprofit sector and the impact on the South Florida community. So stay tuned for that. We will also be having a conversation soon about the hurricane issues facing South Florida. So thanks once more. Bye, everyone.
Goodbye.
Take care, everyone.